Hi guys, welcome back to the Kevin TV. On this episode, I want us to talk about something very, very, very important. We are going to talk about medication. As you know, medication can save life. At the same time, it can also take life if you don't understand them properly. So you being a nurse, you need to understand medication. You need to know their side effect. You need to know the mechanism of action. Then you need to know the nursing intervention for each medication. In this episode, we are going to talk about some common medication you are going to encounter at the ward. We are going to learn about their mechanism of action. We are going to talk about their side effect. Then also talk about the nursing intervention for all these medication that we are going to talk about today. When we talk of mechanism of action, it talks about the drug that you have taken in, the action that this drug is going to perform in the body to bring out the effect of the drug on the body. So what take your drone in? How is that medication that you have taken how is it going to work? So how it's going to work on the body and how it's going to generate the effect that you want to know. And then what the mechanism of action of a drug or medication. The first medication that we are going to talk about is paracetamol, which is also known as acetaminophen. Paracetamol belongs to the antipyretic class of drug, at the same time the analgesic class of drug. Its mechanism of action is going to work in the brain to reduce fever and also relieve pain from mild to moderate. Going to work in the brain, then relieve pain from mild to moderate. The side effect of this medication or the side effect of paracetamol is they can cause toxicity on the liver if you overdose it. And mostly, most of our ladies who have been experiencing menstrual pain and menstrual cramps, full tab is dangerous. You are causing problem to the liver. So please be careful. That's the side effect. So should in case you want to give paracetamol, what will be the nursing intervention? The first one is you need to make sure you check the daily total doses that you're going to give each and every day. You need to make sure you as a nurse, you check it. Then you need to make sure educate the patient not to mix the paracetamol with alcohol. Already, alcohol have a dangerous effect on the liver. When you take it, when you take in alcohol regularly, you can cause problem to the liver. It can lead to liver cirrhosis or damage the liver. As you know, the liver too is an organ that's going to perform the metabolism or going to initiate the metabolism process in the body. So please be careful when you're taking in the paracetamol and at the same time taking in alcohol. It's a dangerous thing. You can cause problem to the liver. Let's continue. The next one that we are going to talk about is furosemide, which is also known as the Lasix. The furosemide, which is also known as the Lasix. This is also part of the diuretic class of drugs. It is a loop diuretics. Its mechanism of action is they are going to pull fluid out through urine. They are going to pull fluid out through urine. Its mechanism of action, the side effect is one, they can lead to dehydration. They can lead to dehydration because they are going to bring fluid out from the body through urine until they can lead to what? Dehydration. So that's one side effect that you can it can cause when you give in the furosemide. So you the nurse, before you give in this medication, so it can lead to dehydration. It can also lead to low potassium level, then also lead to dizziness if you give in this medication. So for giving the furosemide, which is also known as the Lasix, make sure you check the blood pressure. Then you need to also monitor the electrolyte level, most especially the potassium. Guys, let's move on. Let's move to the insulin. The insulin. Insulin belongs to the anti-diabetic class of medication. And this medication, its mechanism of action is they are going to help glucose to enter into the body cells for energy. That's the mechanism of action for insulin. They are going to help glucose enter into the body cells for energy. Its side effect, one, can lead to hypoglycemia. Then it can also cause sweating, can lead to sweating. When you give this medication, sweating can what happen. Then it can lead to shaking. So before you give this medication, these are the nursing intervention you need to do or check when you give him this medication. The first one, you need to make sure you check the blood sugar level before administering this medication. Aside that, you need to also encourage the patient to eat after a short-acting insulin. You need to encourage the patient to eat after a short-acting insulin. So that's also about insulin. Now, guys, let's move to amoxicillin. Amoxicillin is an antibiotic class of medication. Its mechanism of action is it kills bacteria by destroying their cell walls. So it's going to kill bacteria by destroying their cell walls. So the side effect of amoxicillin is allergic reaction. They can cause allergic reactions such as rashes, then difficulty in breathing. Then they can also lead to diarrhea. So before you give this medication, you need to make sure you check the allergies or check and see whether the patient is allergic to this medication or not. Let's continue, guys. The next medication that we are going to talk about is amlodipine. When we talk of amlodipine belongs to the calcium channel blockers, which is under the antihypertensive class of medication or class of drug. Its mechanism of action is one, they are going to relax the blood vessels, then they are going to also lower the blood pressure. So going to lower the blood pressure. So the side effect of this medication is they can lead to swelling of the ankle. Then they can also cause dizziness. Then also cause headache if you give him this medication. These are the side effects that you're going to see. Then when we talk of the nursing intervention, before you give this medication, make sure you check the blood pressure before you give this medication, known as the amlodipine. So these common medication are some of the medication that you are going to encounter at the ward, and you need to know they can save life and at the same time they can take life. Keep on watching Kevin TV. Stick and stay with me. You're going to learn a whole lot. I love you guys. Bye bye.